I have arthritis. That was a gift, I think, from my parents, you know, genetic gift. When I would exercise, when I would run, I would just have a lot of pain, a groin pain.
A lot of people have groin pain, which is actually kind of surprising to some people, that most of the hip pain is actually referred into the middle part of the thigh.
You would think, well, hips out here. You know, I would naturally think, well, I'm not having any pain in here. I'm having tremendous groin pain. Well, fast forward, now I understand that that's one of the signs of you know, having hip issues.
So you can't do what you want to do. You have trouble with your normal daily activities, normal exercises, even just getting up out of bed or out of a chair. That's when you really should start talking to an orthopedic surgeon.
I had to sell my car and get an SUV because I was thinking, well, maybe it's the way I'm sitting while I'm driving. Nothing alleviated. So with an SUV, I can just kind of slide in, and eventually that didn't work either. And I thought, boy, this is really an issue.
So the goals of a total hip replacement is to alleviate the patient's everyday pain, trying to improve their range of motion and also to improve their quality of life.
The minute we stepped into the office, we knew we were in the right place.
Betsy is a very active woman. She came to see me after my partner had retired. He had done the posterior hip replacement for her. For the posterior hip replacement, the incision's in the back part of the hip. It tends to be a larger incision. You actually have to cut through the muscles to get to the back part of the hip. It takes about 6 or 8 weeks for those muscles to heal back to the bone, so you do have restrictions with that. The anterior hip replacement, since we're not cutting through those muscles, you don't have to worry about that stuff. I actually push the muscles off to the side, and then we do the hip replacement that way. We're not taking any of the muscles off the bone, so you have a faster recovery and less pain.
If you are a candidate, it is a no-brainer. I was climbing the steps the same day of surgery. Okay. Out the next day, I was on a walker for 2 days, and I was on a cane. I got out on a Friday. On Monday, on Memorial Day, I was shopping for a couch.
At 2 months, she was back to all of her activities and really increasing her endurance. And then when I saw her about 4 or 5 months after the surgery, she was biking 20 miles a day.
It was just amazing. It's absolutely stunning.
The majority of patients do very, very well after the surgery. It's something where when you wake up, that normal hip pain from the arthritis is gone.